Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
Dr. Josh Luke here with another episode of the Health Wealth Podcast and Radio Show. This is episode 4 of the Health Wealth Basics series, where we're just getting you started on terms to know as you make that decision to start reducing wasteful healthcare spending within your organization. This episode is going to be about what I call the 3 Ps to health wealth. And just to get to the point here, the 3 Ps are really simple. Number 1, have a plan. Number 2, that plan is going to be rooted in 2 types of medicine: preventative medicine and personalized medicine. And when you go through the 9 steps to financial recovery as outlined in Health Wealth, you can see the book here on this side of me. Health Wealth is Healthcare Bankrupting Your Business, 9 Steps to Financial Recovery. You'll see, as I got done, I actually didn't come up with this concept of the 3 Ps to health wealth until I was done, because as I looked at those 9 steps to financial recovery, they were all about 3 things really: having a plan, and that plan consisting of a personalized medicine approach and a preventative medicine approach. So let's talk a little bit about more about some of those tactics and how you can create a plan, not just for yourself, but you can encourage each of your employees to create a plan so it will bring health wealth to your entire organization as well as that individual. So having a plan for your health is an easy one. And when you read the 9 steps, you're going to see things like absenteeism as one of the steps. You're going to see telehealth and remote monitoring capabilities being provided by your organization as a way to enhance that plan and that journey to health wealth. You're going to see an encouragement for the employer to actually pay for DNA testing or genome sequencing, if you will, for employees as an incentive and a reward for retention for sticking with them for a year or 2. Hey, we'll pay for that. And then we'll pay for you to consult with a doctor or a pharmacist so you can look at your pharmacogenetic makeup to see which medications work on you and which ones don't. Yes, folks, that's real technology. It exists. In fact, it's so real that when I've sat down with doctors to look at it, they're a little bit frightened, because they say it's so real that when I prescribe it, what if when the patient goes to the hospital, that information's not in the electronic medical record? There's still a lot of kinks we need to work through to make this real. But guess what? Guess who can own that process? The patient, the consumer. Get that pharmacogenetic report, take a picture of it, and every time you go to the doctor, say, hey doc, here's the medicines that work on me and here's which ones don't. That's not that revolutionary, but you say to yourself, wow, as soon as my kids a few years ago, my Gen Z kids taught me, Dad, why are you writing stuff down? You just need to take a picture of it. I've really taken that to heart. I take a picture now of everything. And when you get that DNA printout from your genome sequence, take a picture, and each time you're at the doctor, clinic, or the pharmacy, say, hey, here's my printout. Can you make sure you're prescribing medicines that work on me and not ones that don't? When you do that DNA test, you also can sit down and have a consult with a registered dietitian about your nutrigenetic makeup and what you're more genetically aligned to eat that's going to be a fuel for you instead of a blocker. Now, just so you know, on the science of pharmacogenetics versus nutrigenetics, pharmacogenetics is real and it's here. Nutrigenetics, there's still a ways to go, but it doesn't mean that you shouldn't start down that path of understanding which foods have already been identified as fuels for you and which ones aren't. So when we talk about the 3 Ps, it's about taking all of these steps to health wealth, and each of your employees having a plan, a personal plan, and that plan is about the 3 Ps. Have a plan, make sure it is a preventative medicine plan as well as a personalized medicine plan. And when you read the book, Health Wealth, 9 Steps to Financial Recovery from Forbes Books, you'll learn all about those tactics, and you'll be well on your way to health wealth. This is Dr. Josh Luke with the Health Wealth Podcast and Radio Show. Thanks again for tuning into this episode 4 of the Health Wealth Basics series called the 3 Ps to Health Wealth. Visit us at health-wealth.com to learn more. Thank you for joining us.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.